Julie Donnelly here from The Flexible Athlete. Today I want to talk about the muscles that actually impinge on the median nerve. So now the nerve begins, as all nerves do, in your brain, comes down your spinal cord, comes out to a bundle of nerves right here on the bottom of your neck. There's a medical term called thoracic outlet syndrome. So doctors understand about the muscles pressing into the nerve, and you can look that up. But the nerve then comes across, and it's right here. Well, there's a muscle called the pectoralis minor that originates on your rib, comes up and inserts on a little bone of your shoulder blade. And when it contracts, you bring your shoulder forward. It's the purpose for the muscle. However, when it's pulling, it's pressing down on the nerve and can cause the numbness to be in your hand. It goes from there, it goes down your bicep. Well, your bicep also originates on that same bone. So if your bicep is tight, it can be pulling on the same bone and putting pressure on the nerve. And then the nerve goes here. These are called your flexors. And it can be getting pressed by any amount of pressure on the flexor muscles. And these are really powerful muscles. They're the ones that you use every day, all the time. And so they can be trapping the nerve here. The nerve then goes through your carpal tunnel, which is right here. There's a muscle here that originates on this side of the carpal tunnel. It's actually the bridge to the carpal tunnel. It's called the flexor retinaculum. And this is what gets cut during carpal tunnel surgery. But the nerve is going through. If this muscle, which brings your thumb into the middle of your hand, so you're using that all the time too, if it gets tight, it's pulling on the bridge and putting pressure on the nerve and causing your thumb and your two fingers to go numb. So it's a longer explanation, treating all of the spasms all the way from your neck, all the way down your arm and into your hand. But I've done that with thousands of people through the years, and it works quickly, and it can prevent you from having carpal tunnel surgery. If you know a fitness trainer who needs continuing education, I teach all this in a 16-hour continuing education course that's been approved by the National Academy of Sports Medicine, NASM.